Okay, today guys we'll take you through a day in the life video, full day of eating for a rest day for me, which is a lower carbohydrate day, and we're also going to initially now go to the physio to get some treatment on my shoulder, and then later on we're going to head and do some cardio and abs. So catch up with you in the physio, get in there now and get some treatment nice and early, 8 o'clock Saturday morning. That shoulder feels like really off.
Yeah. Okay, back down and then forward slides.
Like even like, I don't know if it's my rhomboid again, it's like probably impinged.
Just do that for me, cross body, and back. And again. Just go straight into the needles.
It's there, I think, where like that left one's impinged massively.
Yeah.
I think it almost like pins my scapula so it can't move.
Turn on the other side, okay. Over there. You got some needles in there.
Juicy.
Juicy.
We're trying to go under the scapula there.
Yeah. So you got a muscle called subscapularis, as well as the rhomboids. So this is one of the places that are hard to get to, but needles are really good for it. It goes direct to where the dysfunction is. Big twinge, eh?
Yeah, that's massive.
So you've got, so if a muscle's tight, it can clamp part of the scapula. So when you lift your arm up, that muscle's being stubborn, saying that you aren't going nowhere, mate.
Yeah.
So the whole idea about putting the needles there, it loosens the muscle and says back off. There are other muscles that can do that function, therefore freeing up the scapula. Yeah. Therefore, it's easier to lift your arm up.
Yeah.
Yeah.
Does that actually feel better already?
But yeah.
Yeah.
That's good. And forwards. Yes. Back down. Yes, up, back down, and then go forwards. All the way up. How's that?
Yeah, it's better. Now it feels more like it's there rather than through the inside of the shoulder, if that makes sense.
Okay. On your side, face that way. So Charlie has loads of issues on a muscle called infraspinatus. So it's one of the rotator cuff muscles. If that becomes very stiff, he loses a lot of function within the shoulder.
Is that because of weakness there, do you think?
It's just it being overworked, I think. Weakness is a word used quite a lot. It can just be a muscle imbalance or end up being activated in time when doing certain movements of the shoulder.
Is that what I can feel if you're like there? It feels like tight and tender.
Yeah.
Yeah. So I think it's someone thinks like my rear delt, but
yes, yeah. Remember, the body's a complex thing. There's so many therapists or people that just want to pinpoint saying that it's this, it's only this.
Yeah.
But you have a group of muscles that do the same thing, the same action. So when you treat the shoulder, you've got to treat everything. So now I'm opening up your ribs and working on serratus anterior. Working on your latissimus dorsi, working on teres, working on deltoid, rhomboids. So me doing this, I'm trying to get the quality of movement back. And sometimes people think that that's a weakness thing.
Yeah.
But it's education, so I'm trying to teach the brain now that everything is okay, that your shoulder can move in these different planes of movement.
To get the muscle to relax.
Yes. But I'm fixing on muscles that can be overworking.
Yeah.
And that kind of tricks the brain to say, okay, I'm not using that muscle that James is on, I'm going to use something else.
Yeah.
Yeah. Just be saying that it's only the shoulder, it's linked to your elbow, your wrist, and your neck. So I always try and look at all those distant joints when treating the shoulder.
I think that's probably the most common place for injuries.
Well, I think so, because we are a race now where we're always on our phone.
Yeah.
So our shoulders are rolled in.
Yeah.
And we drive a lot too, so looking at the blind spot a lot of times can cause tension in the neck and lead to our shoulders. Most importantly too, we don't know how our bodies work fully. So like many people don't know the massive effects of how to like stretch. They might have heard about yoga and Pilates, but sometimes you don't actually need that. Like you just need to get 2 minutes a day of effective stretches. So, like, most importantly, we need to be educated on how to be more effective and mobile in all our joints in our body. So the first time working with you, Charlie, right, you were very tight in your shoulders, right? So you've improved a lot. So remember, ages ago, you couldn't even do that.
No.
You were here, but now you can fully go and do
quite
this.
big range.
Yeah.
Even like when I do that, it feels like my shoulder wants to pop.
Yeah.
Like blood pressure or something.
Yeah. So I'm just going to click your neck. So it's the same routine as before. Deep breath into me. Down out. Deep breath again. Down out.
Interesting thing I just thought about, I feel like my top of my chest has developed really quite a lot the last few months, like 6 months maybe.
Yeah.
Do you think that's pulling a lot into my AC joint perhaps? Or is it more muscle tissue?
You can have some factor, but most importantly, when you have a bigger chest, it can affect your shoulders rolling in.
Yeah.
That's why it's so important to stretch. Because there's so many people that go to the gym a lot and do a lot of upper body, and they don't stretch just before and afterwards. So you find that people tear pecs now, you know, because it's overworked. But you are good, right? Because you're starting to stretch out, and you see the importance of it. Flexors. So you work through psoas. I've got my thumb on one of his glute muscles as well, and the finger pads on his psoas.
Well, I find it helps for I train, I get that massage going, I stick it in my hip flexion, take it through range.
Perfect. See, the human body is a weird thing because someone can have the same issue what Charlie has now, but there's always a different way of treating. So what should happen with a therapist and a patient is finding out the go-tos. Where are the places quick,
Like trigger points.
like trigger points, or to make a big change. So I know needles,
work really well.
just around the scapular area, frees up your shoulder. I know to get this range better. Need to work through the psoas. Yes, so it's moving a lot better. Needs a little bit more, and that's just a minute of just working in there. I know working through the diaphragm will improve things. Like even doing that clips your lower back.
Yeah, it's in pop. You feel that?
Yeah.
It's always internal muscles holding everything locked, isn't it?
Yeah. So already it's a lot better. That's taking a lot of stress off your lower back.
You tend to like hyperextend almost, and if you get too tight, then you try and take it to that range if it's not going to go.
You got to think the pelvis likes to move a lot, so it can move forwards.
Yeah.
It can rotate a bit. It can move backwards. So the whole idea of what I'm doing now, I'm trying to get that function back off the pelvis. And once again, there's loads of muscles attached to the front, the sides, and the back of the pelvis. So I'm just trying to investigate what is tight as I'm treating as well. Massage is key, right? The trick with massaging the lower limbs, there's so many people that just treat the belly, but you got to treat the tendons. So the origin of the muscle, the belly, the insertion, but not just in the middle. So you got your rectus femoris here, you've got vastus lateralis, you've got the IT beams, and here you've got the adductors. There's so many people that don't even treat here, you know. And once again, all of these tendons attach to the pelvis.
Pulls into the groin, isn't it?
Yeah.
It's quite common people get groin strain as well.
Exactly. But that's a common thing. You see a lot of football players, people that are very explosive, tend to tear the adductors. You see a difference?
Yeah, massively, massively. I don't think it's actually physically possible for that leg to go any further, really.
Yeah. But you got to think the reason why that was restricted, it wasn't just the hip, it wasn't just the pelvis, it was your lower back, it was your adductors, you know. Basically tendons are so important, you know, because they're well innervated. So like the reason why I'm placing my hands there is to create a stimulus to tell the brain to relax, that there's an issue there. Leave it out, mate, you know, make it nice and loose to bring out back the function. that
The SI joint
the lumbar spine's moving well, and the SI joint is.
Yeah.
Whereas on the other side, it was stiff. There.
Yeah.
So it's more muscle, I think.
Yeah.
So. Yeah, so it's your glutes are very tight here. Got something called TFL. So that's the muscle that helps you to lift up and rotate at the same time. Loads of sprinters have really good muscles here.
Yeah.
Is that quick explosive strength. Yeah, so your psoas is incredibly tight compared to the other side.
This is almost like it's loading my right hip and then my left lower back at opposites.
Yeah.
Oh, that feels like it's kind of locked on.
Yeah. So this is good where I can use an elbow in here, and then Charlie just normally just drops his leg up and comes back in. Let's do that a couple of times. It can be a leg off the table, so a leg off and then back onto the table. Then it can be a sliding down and back up.
Especially if you're trying to take it to the range, aren't you?
Yeah.
Massive pressure drop there.
See the difference?
Yeah, massive.
Yeah. So that's the go-to there, like instant, takes a couple of seconds.
I almost feel I can breathe easier though.
Yeah. So when I did this on the other side, his back clicked.
Yeah.
Yeah. But there's nothing wrong with his lower back on this side.
Was that my SI joint on the other side?
SI joint, yeah. He's very tight in his ribs, so this is his costal margin here. So I'm just trying to take the tension away.
Nice to stretch you out.
Oh yeah, there's nothing better than being stretched out, eh? So every time I treat, it's not just that I'm treating, I'm assessing. So you would find, if you notice, that I'll go back to an area to see if working here has a massive effect.
Another area.
Working here, yeah. So I'll assess this, and then I'll say, okay, what if I treat here? Would it make this better?
Yeah.
So I'm thinking this in my head because the patient doesn't want to fully know everything what I'm thinking of.
I'm a nerd.
So what, you know, because Charlie will think that I'm talking like forever, you know. So you're basically just being Sherlock Holmes. You're going to solve a case of a patient.
Body investigation.
Yeah. People that need to get the tendons worked on in the triceps. Because when you're doing tricep dips, you're really stressing these areas here.
Yeah.
So you would find that I've got loads of patients that tear triceps or biceps tendons.
Yeah.
Because they don't warm up very well, or they don't know how to, you know. So you can do this by yourself. You can just basically have like a biceps, bend, straighten. That's like a prehab thing. So that just gets your muscles working just before lifting heavy. So that's a perfect example of a patient understanding how his body moves, and that educates me as a therapist. So it's never just the therapist knowing everything, you know? Right, leave there for a bit.
Do you think that's more of an overworked issue than anything?
100%.
That's like, Jesus Christ.
Yeah, better.
Mate, that is like night and day. When you put my hand on my head, I don't think I've ever fucking felt my shoulder move like that. There.
Yeah.
That is like...
Okay, we're going on the journey now.
Okay.
Are you ready?
We're taking off.
Yeah. So tight. Another side for me. Round two.
Do you get some people who don't need to be manipulated at all like that?
Oh, of course, yeah. So once again, it's you listen to it. So there's so many therapists out there doing loads of YouTube videos, right? They aren't thinking about what they are doing.
Yeah.
So
just do the same shit.
So it's assessing. So when you were on your back, I knew that there were certain joints that needed to click. You know.
I can feel this is gonna crack already.
Yeah.
There you go.
Are you back? Yeah, because like there were so many people that just say, yeah, I want to click everything.
Yeah.
But when you click something, you want to pinpoint where you want to like click, rather than clicking the whole spine or the whole neck. Right.
Mate, my shoulder feels crazy, the amount of pressure that's dropped out of it.
That's good.
See now that, like, you know, like when you try and take something through range, you can feel whatever's limiting it.
Yeah.
That now feels like the weak point is the glute that's now stopping that.
Yeah.
But everything else is loosened. Fucking hate this.
It's very tight. So try and need to stretch more in the bum.
Is it piriformis glute?
Perfect. Just the whole thing, like gluteus maximus, piriformis, gluteus medius, and minimus. You want to have a perfect form how you lift, so that like therapy is sometimes good to optimize joint function to get you in those positions and ranges.
It also protects the soft tissue damage as well. If your range is limited, it could cause problems.
But you got to think, exactly, mate. But the best athletes in the world have their own team around them, and it's not about when you're in pain. It's about maintenance work, the recovery.
Pain,
yeah, lasting longer on the football pitch, for example.
Yeah.
Things like feedback's key. So me and Charlie always talk. So it's not just about being in the therapy table or therapy room.
We talk about general shit.
Like without talk, but like during the week he would tell me that he did this in training and the treatment really helped.
Yeah.
So feedback is so important because there's only so much that you can do in a therapy room. That's why I always say to my clients, it would be good to message me after the treatment, a couple of days, how it went, you know.
I can generally feel my left arm feels light, if that makes sense. Probably almost the pressure's dropped out.
Yeah.
I notice I get a bit of pins and needles in that hand when I sleep sometimes as well.
Yeah.
That's probably an impingement in that shoulder. I think sleeping in weird positions can probably bring stuff on like that a little bit.
100%. You're going to think that muscles shorten and lengthen when you sleep.
It's like even when I laid on my shoulder last night, my left side, it was fucking hurting. It felt like my bone there was just literally like poking out.
But at least to another point, you've got to have good pillows.
Yeah.
And anyone's pillow is different to anyone else's.
Yeah.
So I actually get patients to take a picture of them in bed.
Yeah.
You know, it's not dodgy, but it's just like seeing how the posture is, you know? Because that's really important. Even taking pictures of them back at work, sitting down, because sometimes it's not good to just get someone's narrative of how they do things on a daily basis. Pictures tell you everything. So many people carry tension in their faces. You got to think there's so many tiny muscles in the face. Once again, the area that many people don't really treat. You got to think that you've got your jaw joint here as well. If that's tight, it can have a massive effect on the neck. And if the neck's tight, have a massive effect on the shoulder. You got to think that the body is one unit, right? Sometimes we can have a reductionist approach and just treat one section of the body. You're good to go, man.
Legend, I think.
Yeah.
My shoulders feel so much better.
Oh, that's good, man. Back in the game, man.
Like genuinely, I couldn't lift my fucking arm, but that infraspinatus, I think that and that rhomboid there, I think are the two.
The rhomboid, subscapularis, infraspinatus. Yeah.
What's that? Because it's there, isn't it?
Yeah.
That's I can actually feel. That's where I normally can always feel where it's tight.
Yeah.
But even when I put my hand in it now, it feels like it's dropped off a lot.
All right, man.
Listen, cheers.
No problem, mate. Pleasure.